Mastitis in small ruminants. It mostly occurs in intensive sheep production. In acute mastitis, the sheep will have toxemia and the lamb will need milk support. And chronic mastitis is an important cause of culling. For gangrenous mastitis, it's sporadic. It happens during the first 8 weeks of lactation. The cause is Staphylococcus aureus from a healthy teat skin, or Mannheimia hemolytica, which is from the oropharynx of the lambs. The predisposing factors are trauma, such as a superficial teat infection, or poor nutrition and bad conditions, and this can also lead to overvigorous suckling from the lamb, as well as contagious pustular dermatitis, also known as ORF. The clinical signs, there's a sudden onset, and the ewes will isolate themselves from the lambs. You can also get lameness, and they'll also have a swollen and painful mammary gland. The mammary gland skin will go from red to purple and then to black when it's very bad. There will also be gangrenous areas, as seen here. They'll have decreased milk production, and due to toxemia, they'll have a temperature above 41 degrees and a heart rate above 120 beats per minute. They'll also get purple mucous membranes. For the diagnosis, look at the clinical signs and do a bacterial culture. For treatment, in an acute case, give antibiotics infusion and NSAIDs, and in a chronic case, have euthanasia. For prevention and management, it's important to have good nutrition to ensure the animals have good condition. And if lesions ever occur, it's important to have proper lesion care. For acute mastitis in sheep, it's sporadic. The cause is Streptococcus, Staphylococcus, and E. coli. It's usually from an ascending infection through the teat canal. Signs are a red, swollen, and painful warm mammary gland. They also want to be isolated from the flock, and they have depression. And the milk can range from normal to large white clots. For the treatment, have systemic antibiotics such as oxytetracycline and penicillin, as well as an antibiotic intermammary infusion. You can also give NSAIDs to help with the pain. For prevention, it's difficult in meat-producing sheep and it's easier in dairy. And it can cause great economic loss, especially in milk-producing sheep, as well as in meat-producing sheep, as the lambs will have decreased growth and you'll have a higher culling rate. The drugs, when it's gram-positive bacteria, use benzylpenicillin and cloxacillin, as well as cephalexin and cefepime. The drugs for when it's gram-negative bacteria use amoxicillin clavulanic acid, cefquinone, and cefoperazone. For chronic mastitis, this is a major cause of culling. The cause is acute mastitis, as well as Trupperella pyogenes, which causes an abscess. The signs are a thickened mammary gland, as well as deep-seated abscesses, or superficial abscesses. For diagnosis, have palpation, and you can use ultrasound for the abscesses. For the treatment, in the mild form, use tilmacosin at weaning, but it's usually not done. Usually you just cull the animal. Contagious agalactica, it's caused by Mycoplasma agalactica. The signs are depression, fever, abortion, as well as clots and decreased milk. For the treatment, it's usually just culling, and for prevention, have vaccine, but there's little protection. The prognosis is poor, you usually just cull the animal.